the first two studies from the Body Cognition Lab and UCD. I said the title says across female adulthood, but I am sneaking in a male study as well.
Yeah.
So I hope I'll get to it. Hopefully I'll have time. I should be about 40-45 minutes. Okay, so the research, as I mentioned, is as part of a group that I lead here in UCD, and Akancha, who's in the room here, is a PhD student and Ad Astra scholar. And just to start off by saying that this research is driven by Akancha's PhD, and I was delighted to have Akancha on board because she really introduced me to the whole facet of body image, whereas traditionally I've been looking at other aspects of body representation. So the research I'm going to talk about is the links between body image and other kind of psychological constructs to do with body representations. And we were really keen to look at it across different epochs of female adulthood, because most from young or mid-adulthood to later on has been largely ignored in literature. So I thought it would be interesting to look at. So just to give you an orientation to body representation, what I mean by body representation is this kind of mental representation that's kind of driven by multisensory inputs that allows us to have a somewhat coherent idea of ourself about our bodies. And it's traditionally delineated into two categories of body image, which has kind of perceptual components and relates to how we perceive our body size, but also a really important attitudinal component, how we feel about our body, our beliefs about our appearance, our size and our shape. And then in a distinct silo, typically we've looked at something called body for action, and that's all the other aspects of body representation that are to do with action. So, for example, we might need to mentally prepare to make an action in our head, and that involves something called motor imagery. And the final aspect I'll be talking about is something called interoception, which Kira mentioned in the intro there, and it's really our awareness of our internal physiological state. So first, the body image, as I mentioned, it's about our appearance-related beliefs, attitudes, and feelings towards our body size and shape, including size and shape. And it's traditionally sort of operationalized in psychological research by looking at aspects of dissatisfaction. It's a multidimensional construct, which Kira talked really elegantly about a few weeks ago, that includes positive body image. I'm talking about negative body image only today, sorry folks. But it's good to know that the body image and positive and negative don't operate kind of necessarily in opposite ends of a linear model. You can have positive body image simultaneously with negative body image. We can hold those two belief patterns in one moment. What we wanted to look at was to go beyond just body dissatisfaction, which looks at kind of concerns about body shape and size, but also to kind of explain the range of experience that people have with respect to body image. Unfortunately, negative body image is seen as the norm rather than the exception, and it's called normative discontent. And often that's maybe because of that we don't take it with the level of seriousness that I think it really deserves. So included in negative body image, we also have, as well as dissatisfaction, feelings of shame. So feelings of worthlessness when we don't maybe fit into an internalized idea of, let's say, a thin ideal, for example. And this can cause a lot of distress for people. Related to that is something called self-objectification, so treating our bodies as an object, as an other. And then a subcomponent of self-objectification is body surveillance. So looking at your body from an alternative perspective, it's constantly looking at your body through a lens of other, constantly monitoring the state of your body as if it were an object rather than actually part of your being. So for this study, we were interested in looking at these three components included with dissatisfaction to measure something called body image disturbance. So a disturbance in body image is usually seen with really heightened levels of dissatisfaction and body size concerns. And what's kind of interesting throughout the literature, it's the most consistent and kind of robust causal factor for all forms of eating disorders and between many genders. But I think really importantly to note, it's often given a lot of airtime with respect to eating disorders, but negative body image or poor body image has really big implications for overall well-being and mental and physical health. So it's kind of highly related to kind of elevated body disturbances, result or linked to increased depressive symptoms, lower self-esteem, as well as avoidance of social interactions. And for adults and in the midlife in particular, it can have implications for sexual health and well-being as well. So what do we know about body image across the lifespan? So we were interested in looking at it beyond just the early adulthood, but just to orient your attention to when it emerges. So it's been shown to emerge as young as the age of 6, super young. Even there's some studies that show the age of 3, comparisons between self and other bodies, which is terrifying. I have a 3-year-old. And by adolescence, it really begins to peak, particularly in girls. They demonstrate particular kind of weight and shape concerns. And then we get into adulthood, there's sort of equivocal research. So a lot of the research said that it's kind of sort of stable from the late teens to 40s. And then after 40, after midlife, there's some research shows there's a dip in body image satisfaction scales, while other using different scales shows an increase. And it really depends on the measure that the studies use. And a lot of the time it's kind of operationalized again as dissatisfaction. I suppose one kind of concern here we had, or interest, was that there's this whole area of life, a woman's life in particular, that's sort of ignored in the literature. It's highly focused on 18 to 24-year-olds, and there's a lot less beyond that kind of early adulthood and beyond. And of course, women have a huge amount of physiological and psychological and life changes throughout our lives, and so as well as pregnancy, childbirth, the menopause, as well as chronic acute illnesses. So we're interested in looking at it from this perspective. So I'm going to move on to interoception, which is a fascinating topic if any of you've heard of it. So it's basically our awareness of and attention to our internal physiological state. So it's the processing of stimuli that originate from inside our bodies, including our respiration, our breath, our cardioception, our heart rate, our viscera. And it really tells us, it gives a moment-to-moment account of what's going on inside. And when we think of it, we often think of it as something completely subconscious. But if you can take a moment right now to see, can you count your heartbeat? Can you feel your heartbeat? Are you aware of your heartbeat? So it plays a large role in embodiment, as it gives us this moment-to-moment internal mapping. And recently researchers have gone on to say, well, it's been linked to a whole host of pathologies, but what about body image? Is there a link between this internal self to an external appearance? So an interoceptive sensibility is the extent to which people kind of report attention towards and awareness of these internal sensations. And what's been found, particularly shown in a recent important review in 2017 by Securis, is that there's this inverse relationship between interoception and body image concerns. So as body image concern increases, interoceptive awareness and accuracy in detecting, for example, heartbeats, decreases. And this has been shown in body dissatisfaction and objectification. Similarly, there's also evidence that interoceptive sensibility declines over age. So the last construct I wanted to introduce is the body for action, or the body schema. So this again is going to sensory motor, supposedly implicit or unconscious representation of the body in space. But in order to sort of index it, we use tasks or mental imagery tasks, because in order to prepare an action or prepare a movement, we have to first imagine it. And we're interested here in the terms of body images. How does imagining your body, how is it influenced by your level of dissatisfaction or your level of body image disturbance, excuse me. So very recently, it's been shown that not just in severely unwell patients, anorexic patients who show significant difficulty in imagining their own bodies and imagining their own movements, it's also been shown people without eating disorders, people with the higher the dissatisfaction is, the more struggle people find in performing tasks which index the body schema. So for the first study, we wanted to look at the relationship between the three main kind of constructs I just described, and it's in Psychology's very first PhD paper, and we're working on at the moment, and it's called Body Image Disturbance, Interoceptive Sensibility, and the Body Schema Across Female Adulthood. It was a pre-registered study, and we were really interested in a couple of things. Do these components of body image I just mentioned change across female adulthood? Does this internal sense of the body also change across adulthood? And there's some good evidence that potentially it should. Does body image disturbance, age and sensibility predict then performance on tasks that require us to imagine our body in space that index this body schema? So the method we used was an online study. We recruited on Prolific. We used Psychopy and Qualtrics and Pavlovia. Pre-registered, as I said, and we had 4 main age groups that were defined in terms of age by the WHO standards. Young adults, middle adults, and older adults, from 18 to 24-year-olds, all the way up to 60 to 75-year-olds. And the reason we had it online is that we wanted to capture a large amount of data, because we wanted at least 250 per age group in order to look at the relationships keeping these contrasts according to the power analysis. So we had 1,200 participants with 300 participants in each age category. Participants did 2 main tasks. One was questionnaire-based. They basically answered questionnaires about their body shape and size questionnaires, body image state questionnaires, as well as a questionnaire about interoceptive sensibility called MAIA, or the multidimensional assessment of interoceptive awareness, which is a really great scale because it has subscales just in a second about noticing and attention towards your body. And then the third, to measure motor imagery, or imagining the body, to really capture that kind of embodiment, we used a motor imagery task, which is a version of an own body transformation task. So in motor imagery, a mental imagery task, we typically ask people to imagine objects from different perspectives. And they can be object-based, as I mentioned, or they can be body-based. So we might ask you to align your body with a perspective of an object and then shift that accordingly. Or we might ask you to take the perspective of another kind of visual stimulus of a body on screen and align your perspective with that one. And typically what you expect is that the further away the body on screen that you're seeing is from your own position and space, the more difficult it is to perform that task, because you have to kind of mentally rotate it, and it becomes more increasingly difficult. So to measure that, we presented participants with avatars that were varied in size according to BMI, and that they were required to look at the avatars on different trials, imagine themselves embodying, they were explicitly instructed, imagine you are where that avatar is or that body is, and tell me what hand these balls are on, either on the left hand or the right hand. And they press a response on the computer, left or right response. So the idea is, as the body rotates away from back facing, it becomes much more difficult because you have to flip your perspective. We presented the bodies in different orientations at 0 degrees, so congruent to your position, and then kind of a biomechanically constrained position called 90 degrees, which you wouldn't usually ever take. Here are some examples of the questionnaires that we used. For the body image disturbance composite, we combined measures of body shame and surveillance from the objectified body consciousness questionnaire, and also from the body dissatisfaction questionnaires. Importantly, the 2 different body dissatisfaction questionnaires, one of them measured your feelings over time in the past, how you feel about your body shape, size, weight over time. And the other one, the body image state scale, is how you feel right now in this moment. And then there's an example there on the right-hand side of the screen of the different elements of the MAIA. So from noticing, distracting, attention regulation, body listening, and trusting, as well as emotional awareness. So for our results. So first of all, we were really interested in what happens over time in these cross-sectional age groups. So we can see when we look at body image composite, so the combined scores of all of these body image scales, that there's a significant difference or a drop off in body image disturbance once women approach later life. at 60. So from 40 to 60 is a difference, from 25 to, so from adulthood to late adulthood there's a difference, and from early adulthood to late adulthood there's a difference. And this is sort of expected given previous findings, but we're also really interested in what happens when we look and parse apart those other measurements of BID. So on the left-hand side is the composite score, and then I'm going to show you the individual scales to see some of the patterns of expression across female adulthood. So for shame, so these feelings of worthlessness that kind of can occur from potentially your body not fitting some external or idealized notion of beauty, we can see a very similar pattern, with the exception that there's a significant difference between 25 and 39-year-olds and 40 and 50 and 59-year-olds, and as well as the same difference occurs, body shame decreases the older we get from adulthood onwards. And then we look at surveillance, so kind of constantly monitoring your appearance or your perceptions of your own behavior in that respect. This is really interesting decrease from early age to old age, with a significant difference between each age group. So the older we get, the less likely we are to report surveillance type behaviors. And then down the bottom are the two dissatisfaction scales. So the first, just to remind you, is what's called the body shape questionnaire, and it looks at over time how you felt over a period of time about your body's weight, size, and shape. And the pattern here is very similar to the overall composite score, in that the main difference is between kind of later adulthood, so the midlife, women's midlives and older lives. Whereas in the state scale, and in the state scale we reverse coded it so that a higher body image state scale score is more negative body image, and a lower body image state scale score is kind of a description of more present satisfaction with your body. You see that the main difference emerges between the two younger age groups compared to the two older age groups, which is interesting because it's kind of sort of the reverse pattern from the other body dissatisfaction scale, which I can talk about a little bit later on. So we were also interested in, does interoception, so our internal awareness, intention to our internal states, does it predict our overall body image disturbances? And we thought it would because of two other previous studies. And what we found was that it did, and it did across all different age groups. And then when looking on the left-hand side of the screen here, we have the interoception scores. You see that interoceptive awareness or sensibility decreases from early adulthood, so adulthood 25 to 39-year-olds until later life, with the lowest kind of interoceptive scores from the 60 to 75-year-olds. So the next question we have is, does our body image disturbances as composite and our sensibility or our awareness of internal states predict our performance on these tasks that kind of tap into this embodiment, embodied mental transformation performance and body schema? Just to remind you that they were the stimuli, and the way we measured it was, there was a couple of ways that we indexed this, but the main way was reaction time and accuracy, and also the difference in reaction time and accuracy between front-facing and back-facing stimuli, and the difference in reaction time between 0-degree stimuli and 90-degree stimuli. Okay. And what we found is, for just the task, is that as we get older, it proves more difficult to complete the task, which typically in these kind of cognitive tasks you expect as we get older, we get a bit slower at it. We see a difference between 0 degrees and 90 degrees in some groups. But the big question we asked was, does body image disturbance really tell us anything about our performance? Can we see a link between these two constructs, or multidimensional constructs? So the first one was that in a hierarchical multi-regression model, age and the orientation of the stimulus, so a 0 degree versus a 90 degree. I haven't got a picture up there, but just imagine the picture up there is 0 degrees, 90 degrees as if you've done twist to the side. So age and orientation accounted for 9% variance in the total model. And the oldest age group was a significant negative predictor of the model. Overall, the model revealed that orientation and BID were significant positive predictors of the transformation cost. So you can this kind of link between a disturbance in body image predicts your performance on the transfer information cost, with the higher body image disturbance predicting lower performance. Interestingly, in contrast to one other previous finding that used hands as stimuli, interoceptive sensibility didn't emerge as a predictor of this body schema or body spatial transformation performance. So in summary, for this particular study, we found different aspects of body image disturbances, we're kind of encapsulating them here, vary across different age groups. Interoceptive sensibility was negatively associated with BID, so basically the stronger your interoceptive sensibility, the less likely you are to have poor body image. And that body image disturbance predicts the amount of time it takes for someone to perform these tasks when controlled for age. And really importantly, it only happens in that really strange 90-degree orientation. And that's because that 90-degree orientation is a position that we would never encounter in real life. So our internal representation of our body is completely incongruous to the one presented. So potentially for people with higher elevated body image concerns, it becomes even more taxing to kind of move away from that kind of egocentric, zero front-facing or back-facing position and kind of update it with incoming visual inputs. So interoception did not predict performance on the body transformation task. And so for the second study, we were interested in looking at this younger age group again. And the reason for that is because we wanted to compare them to age-matched male groups. So we had a study run by some members of the lab, Marina in particular, and they collected data from young adult males living in the Republic of Ireland. And then we age matched them to the 18 to 25-year-old group from the original study and took only participants from the UK and three other European countries. So that were as tightly as possibly compared. It would have ideally been another Irish group, but they're still quite comparable. And why do we do this? So there's sort of a long history of body image being highly focused on females. And one of the reasons behind that is the idea that a core aspect of women's identity is our body image, and that men don't really have this, which recent research has shown not to be true. But it's interesting in that these ideas that women drive to be thin and men drive to be muscular aren't necessarily the whole picture, because over the years we've seen that actually women and men both have drive for muscularity and drive for kind of what's often called reduction in fat distribution, kind of a reaction or negative reaction towards any kind of body fat. And what's kind of interesting is that over time, research has shown that men and women tend to engage in different behaviors to control this negative body image. So women's drive for thinness, for example, might result in restrictive eating, whereas men's is thought to result in kind of over gym use and steroids. And I think that's kind of been shown recently to be changing over time. But we wanted to see in this exact same setup with measurements that measured male body image, would we see a difference in males and females in body image disturbance? And we predicted that, akin to other research, there'd be a higher body dissatisfaction in women compared to men. There'd be a significant difference in interoceptive sensibility between both males and females. And we really thought that there more than likely wouldn't be any behavioral difference in how they perform this body transformation task. But we were interested to see if we put it into a regression model, would interoceptive sensibility alone kind of predict it despite gender? And the power of interoceptive sensibility to kind of predict body image disturbance despite gender. So again, the exact same setup as last time, just with two important differences. There was 170 participants, 86 in each age group, and it was just one 18 to 24-year-old groups, two 18 to 24-year-old groups. And then for the scales, there's adaptive scales in the body image disturbance that work well for males as well as females, with the caveat that there aren't as many questions about muscularity in those scales. They're often really focused on size, shape, and weight. So did we find a gender difference was the very first question. Like, is there a difference in gender in both body image disturbance and interoception? And we found, first of all, a difference between males and females, where women have significantly elevated BID composite scores compared to males, and this was across all of the subscales. And secondly, interoceptive sensibility, we see that men had somewhat higher, though I think it was a pretty small effect size between males and females in interoceptive sensibility. And then when we put it into a hierarchical regression model, we could see that gender accounted for 11.3% of the variance in body image disturbance. And then when IS or interoception was added to the model, it was an additional 8%, explained the variance. So we see that both gender, when male was entered first, and interoceptive sensibility kind of predict body image disturbance. The next question was about this simulation task, this embodied mental transformation task. And as predicted, we didn't see a gender difference. They performed fairly comparatively. They're both pretty good at the task. There's a difference in 0 degrees versus 90 degrees. There was no overall gender differences. But we wanted to also see if BID and interoception could predict performance on the OBT task, on the schema task. And we found that it didn't really predict much. While there was kind of partial about gender and orientation, it explained a little bit of variance, but once BID and interoception was added, that really didn't change much from the null model, though I think the overall model was significant. So what are the take-home points from these studies? I think the first is that when we think about negative body image, we need to go beyond just dissatisfaction and think about a host of constructs that are widely studied often in silos within body image research, and to really go beyond just kind of obsessions about shape and weight to how we could kind of consider our bodies in our mind's eye. You know, not all of us have heightened visual imagery, and there is definitely variance there, or variability there, but the ways in which we imagine our bodies are influenced or may influence body image concern, and vice versa potentially. And the second kind of main take-home point from those two studies is that those trajectories in the female study and with women over time show different trajectories for different scales, in particular surveillance and how we feel right now in this moment. And they also differ completely between males and females. So going forward, maybe including more scales about driving muscularity for both males and females. And I think kind of, for me, the most interesting finding, and one that's kind of driving the current agenda in the lab, is that when we think about these differences, the main difference is drop off between midlife, so mid-adult life to older adult life. And of course, as I mentioned, that 40 to 60 year period is full of physiological changes, perimenopause, menopause, postmenopause, and for women who have children, etc. So what's really interesting here is to look at what else is kind of contributing to negative body image, not just societal ideals. For example, does the women's experience of, let's say, menopausal symptoms increase their self-reported body image disturbance? And on top of that, often we think about this whole kind of epochs of females' life as they don't really care about their body image. They're too old to care, or because, you know, as we get older, women's bodies, due to fat distribution and change from their appearance to some kind of internalized ideal, and therefore women don't have dissatisfaction. I think from these data we can see that it's a little bit more complicated than that, and there's a lot more going on, particularly in relation to life changes. So at the moment in the lab, we're looking at menopausal symptom severity and how it can predict both positive and negative body image outcomes. So I wanted to thank everyone, particularly all the lab members, and Akansha, who's sitting here, who's driven this research, and without her I wouldn't have ever been tuned into body image research at all. So a big thank you to Akansha and Marina and the rest of the lab. So I'm happy to take any questions.
Okay. So So open to the floor. So you have any questions? Well, yeah, go Susie.
So thanks for that. I actually did supervise a thesis a number of years ago on a clinical student who was looking at interoception in the context of compassion focused therapy. Because the idea, for those who are not familiar with CFT, the idea is there's an element in mind-body attunement and tuning into a sort of felt sense of your distress. And it was a small mixed method study, but what Marion found was that there did appear to be an association between progress through CFT and improvements in interoception as you sort of learned to tune into your body more. And I'd never heard of the concept before Marion's thesis. So it was I really enjoyed. It was really nice having that sense of the subject, and obviously we'd use the same scales.
It's really interesting to hear that it changed over the course of the program for them as well.
Now it was a small sample, but it was mixed methods, so we were able to map the quantitative onto qualitative reports of tuning into their body more, and that was being supported through the self-compassion. The question I had, I suppose, is whether there's any. I was really fascinated by the age differences. But I wonder how much of them might be, you know, from Brenner's chronosphere, this idea of sort of social changes over time. Like, would that cohort of older women always have been lower? And is there any evidence to suggest that those of us who are maybe in the previous category might not necessarily make it there because of societal factors?
Yeah, that's a good point. I think one of the limitations is for sure that it's a cross-sectional design, and a lot of the studies are. I think I saw one longitudinal study, a meta-analysis of longitudinal data.
Yeah.
And again, it seems to show that dissatisfaction remains constant until 40, and there seems to be a bit of a shift.
Okay.
This is longitudinal.
Yeah.
So you're more likely, I believe, but correct me if I'm wrong, from the experts in the room, that if you have body image disturbance or poor or negative body image from an early age, it tends to stay in place unless there's been some kind of intervention. And it can be quite hard to remediate. And I like the point about it's interoception, but it's also kind of mindfulness and meditation. It is tuning in by whatever avenue you choose to your internal self to kind of mitigate this kind of, a lot of the time people with image concerns have an overemphasis or weight to external visual information and we're at the expense of the internal body. So it's great to hear that changes in your study as well. Is that okay?
Yeah, thank you so much.
Okay. We have a question from Nuala online, so I'm just going to let her talk and
Hello, can you hear me okay?
Yeah, I can hear you.
Okay, thanks very much, Sarah. Lovely talk. I was just very struck by the age differences, and obviously you've addressed the whole issue of, you know, changes in the cycle, and they're great age groups because your oldest women are all going to be postmenopausal, and the next group down are probably going to be a mixture of perimenopause and menopausal women. And I was just wondering, Sarah, is there any link or research between like actual hormonal levels and interoception? And I was just wondering whether anyone had looked at this in younger women. Obviously, the changes in hormones over the menstrual cycle are quite different than those over lifespan. But I wonder, is there like fluctuations in interoceptive ability just depending on time in the menstrual cycle? Has anyone ever looked at anything like that? Do you know?
Great question. I know that there's work of Jenny Murphy in the UK who she looks a lot at interoception, and I believe either she's about to come out or is currently working on a project that looks at fluctuations in interoceptive. I think it might be accuracy rather than sensibility, maybe both measures in relation to hormonal changes over the kind of the cycle. But I'm not sure if it's out yet. I haven't seen it out yet, but I can look it up for you, Neil. But it is a really important kind of aspect to be able to actually track it down to that 30-day cycle and see if it's linking into hormonal changes. That will be fascinating to see.
Thanks very much, Sarah.
Thank you.
Can I just check with you again? What did you find with the shame? Was it that it increased as they got older? And the
shame, I put back up on the screen. The shame, I'm going to wait for a second.
Because there's different aspects of.
I think that the shame had a very similar pattern to the overall composite score. So it was, the drop off was mostly before older. There we go, the top one is shame. So
the shame was low actually as they were older, is it?
Yeah, so the lower the score, the less shame.
Yeah, and overall the lower, the older women had less body dissatisfaction.
Overall in the BSQ, they had lower body shape concerns. But in the BIS, they had, in the BIS, the body image state, how are you feeling right now, they had higher.
Oh.
They're very different, they're slightly different measures.
Which was state-like, was it?
State like
yeah.
right now.
Okay,
yeah.
yeah.
So what does that really tell us? Is it, are those, first of all, kind of methodologically, they're tapping into different things, how do you feel right now in this current state in front of the computer?
Yeah,
How do you feel over a series of times? I could index it.
How do they correlate those two
Yeah.
components, the state measure and the more
I think they're very highly correlated.
I don't think we actually ran a correlation, but
They must do.
I don't, yeah. All of the measures were highly correlated, so that's definitely not, but.
The state rate thing is interesting because obviously you're relying on different sort of periods of reflection.
I think the interesting thing is that the body image state scale is like only like 9 questions, and I think 2 of them involve comparing yourself to another person. So I think that was the most interesting question to me, because I don't know if like that would have driven a lot of these differences, because maybe it's just that there's negative self-evaluation that's increased in like older adulthood, so you think you look worse compared to like other people, or like other people of the same age even. So yeah, I think the individual items might be driving the change.
The item piece might be interesting because it's kind of related to self-surveillance and objectification as well. It's driving it, yeah.
And do the measures hold across the different age groups? Do they, there's the same stability in them? We probably didn't look at that, but say the reliabilities are holding in them and all that.
Yeah, the item reliability across the different ages would be interesting to look at.
And then do you start to see sort of differentiation of different aspects over time?
Yeah. I suppose from when you're thinking about it over time, it's the older women have a longer period of their lives to reflect upon compared to a 25 or 18-year-old.
Yeah.
So that could change how you reflect as well, because it might have shifted in the last 10 years compared potentially if it has. But yeah, certainly something worth looking at in the next study.
It's really interesting also that it's the 25 to 39 age group with the highest shame and dissatisfaction. Surveillance, well, not so much surveillance, but even the state measures as well. It's kind of, it's quite interesting because a lot of the focus, as you mentioned, is on the younger age groups, but we actually see here that it's important to consider it in the college years as well and beyond. You know, yeah, it's really interesting.
Don't think roll on 60s.
60s, 75, unless you want to think about how you feel right now.
Yeah.
That's about it.
And that would kind of mirror the well-being paradox, that you see that kind of increase in well-being quality of life as they move towards the 60s, that's that.
Unless, of course, Erickson's generativity versus stagnation comes swooping in to undermine everything you've gained.
Any other questions? I'll just check if there's any questions online.
What's the next step for the research?
So at the moment, I was going to show it today, but I didn't. I just collected data with a student who looked at menopause symptom severity with positive and negative body image facets. And so far, and we've only kind of just started looking at it, that the higher symptom severity I have indicates higher negative body image and lower, higher positive body image, or lower positive body image. So we need to kind of look at it more closely. But we've managed to get a pretty good sample. I also measured interoception as well. So just symptom severity on that whole scale predict your self-report of your interoceptive ability. And you can see it was really clear relationship between the two. So that's where it's going with the older age groups on the back of this, and then Akanksha has a great study for a final piece in her PhD that looks at a lab study where we're using VR to examine these kind of implicit body size and body schema.
One of my favourite undergraduate projects ever was a student who was looking at body image in different types of nuns.
Okay.
So he had open order nuns, closed order nuns, and semi-open order nuns. And his whole interest was whether exposure to society was a factor. But as I started to read about interoception, you would wonder if sort of intense prayer, meditation, that sort of stillness and practice might have actually meant that there was elements of interoception at play in terms of how they were tuning in. But he was looking at it from the point of view of this sort of lack of exposure to modern society.
Yeah. It's definitely, I think, a good basis to do as a mediating or moderating role of interoception. I ran a study a couple of years ago with Ashling, and she looked at that. It was during COVID, and it was interoceptive sensibility and mindfulness-based practices. So people who said they had, a meditation practice or as broad as yoga or Tai Chi even. And we saw that relationship again, that the more they practice, more frequently they practice Tai Chi, yoga, and meditation, the higher interoceptive sensibility they have. So it's definitely something going on. Yeah.
I have a question about the interoceptive awareness and the oldest age group or age category in terms of, I think, was it that they had tend to have lower kind of interoceptive awareness, but yet lower body dissatisfaction, was it?
So the older
in the women's.
women it decreased with age.
Yeah.
They also had.
But the other factors might have.
There's kind of ideas behind kind of plasticity there as we get older. These kind of our interoceptive processes might decrease, and it enables kind of a expanded plasticity of representation of the body. It's one kind of theory behind it. It's kind of the idea I like to think of is that kind of interoception is working there behind the back in the background, and it's kind of feeding in to these two big representations. One for movement and one for how we feel about our bodies and perceive our bodies. And then there's kind of up top is the representation. So it's kind of like a ground up kind of embodied framework to start to understand it. And there are some interesting theories out there about how they might interlink. It's just there's no concrete evidence from all of them. So this is sort of a starting point to link them all.
Of course, yeah. And just within the male-female interoceptive awareness, you notice that males had slightly higher interoceptive awareness than females. Was there any particular parts of the interoception that they were kind of higher on, or was it a global kind of score?
Great question. I think we definitely want to look at the subscales. We haven't looked at it. Have you looked at it yet?
Not yet. But we're thinking,
We're kind of just running a big network analysis on the Maya data because we've loads at this stage. And she's looking at a network between high and low BIDs for all of the different. Well, what we look at items.
The subscales of the Maya are like the nodes, and just understanding how the nodes are connected to like body image disturbance nodes and like a high body image disturbance network compared to a low body image disturbance network. To kind of look at how like not disease, but like kind of like how high body image disturbance pathology spreads, because it's like network analysis is often used to like research health behaviors, so it's always like thinking about things like disease and spread. But
that's so interesting, because it's sometimes a cascade if you have one.
Exactly.
How does it feed into others? Yeah, absolutely.
I wonder if for the male group they do play out differently for attention to noticing, just not distracting, worrying, and emotional awareness compared to females. There's a little bit of data I think that another group might be interested in how we exploratory look at it.
And was there any, sorry, I know I'm not, was there any links between the surveillance and then the interoception? Because again, it was both focused at self, but just at different aspects of self.
So the interoception predicted, or had a linear relationship to all of the subscales, right?
It was very strongly correlated to all of the body image subscales, and I think it was the strongest with surveillance.
Interesting. Yeah. That's so interesting. It's fascinating, that mind-body link, because I think a lot of the research on body image focuses on the aesthetic part, but this is really important in terms of, even as you mentioned, the CFT, in terms of what's the action mechanism trying to change perceptions and like focus inward. Actually interesting, my own PhD did use CFT with for body image perceptions. And we did see change, but we didn't have the interoception kind of as a measure. But it would be so interesting if that was the mechanism through which people experience change. But it's really interesting, because I think you're kind of doing something novel in that you're linking the embodiment to mind-body connection in the space body image, which isn't really like, a lot of people are not doing that. So I think it's fantastic that you are guys, and you're kind of ahead of the curve in that respect. So yeah.
It's great to understand more about how it's used in the applied setting as well, because it's kind of, we can get kind of stuck in the silo of experimental research and not realize it's actually important to use it in interventions and in kind of self-care and well-being.
Yeah.
So it's great to see that it's actually happening.
Yeah.
You know, within a bunch of different studies. So.
Thank you. Okay, any further questions? We have none from online, so we want to thank Sarah for a great talk, and
And can I just add in at the end, just a big thank you to Ciara for leading our